Anastrozole is a medication that is commonly used to treat breast cancer in women who have gone through menopause. This medication works by reducing the production of estrogen in the body, which in turn helps to slow down or even reverse the growth of certain types of breast cancers that are fueled by estrogen. It is usually taken as a 1 mg tablet and is typically recommended to be taken once a day, preferably at the same time each day. It is best to follow the instructions of your healthcare provider regarding the timing of taking this medication. When starting anastrozole, it's important to read the patient information leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually once a day. It's best to take it at the same time each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and may increase your risk of serious side effects. It's important to note that women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets, as it may harm an unborn baby. Some common side effects of anastrozole 1 mg tablet aromatase inhibitors may include hot flashes, headache, bone pain, trouble sleeping, dizziness, stomach upset, nausea/vomiting, constipation, diarrhea, loss of appetite, weight gain, tiredness/weakness, increased coughing, or sore throat. If any of these effects persist or worsen, consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects such as easily broken bones, pain/swelling of the joint/muscle/tendon, mental/mood changes, such as depression, numb/tingling skin, swelling hands/ankle/feet, shortness of breath, unusual vaginal discharge/bleeding/burning/itching/odor, pain/redness/swelling of arms or legs, vision changes, signs of liver disease, such as nausea/vomiting that doesn't stop, stomach/abdominal pain, yellowing, eyes/skin, dark urine. If you experience very serious side effects such as chest/jaw/left arm pain, confusion, trouble speaking, weakness on one side of the body, it's important to seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Before starting anastrozole, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your healthcare provider. It's also important to share your medical history with your doctor or pharmacist, especially if you have a history of heart disease, osteoporosis, liver disease, high blood pressure, or blood clots. Anastrozole may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or any activities that require alertness until you can do so safely. Limiting alcoholic beverages is also recommended, and if you use marijuana, be sure to talk to your doctor about it. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. This medication can be harmful to unborn babies, so women who are pregnant or may become pregnant should not handle this medication or breathe in the dust from the tablets. Anastrozole is primarily used in women after menopause, and it should not be used during pregnancy. If you are taking this medication, it's important to use reliable forms of birth control, such as latex condoms, and to avoid using products containing estrogen, like birth control pills. It's crucial to discuss this with your doctor and to notify them if you become pregnant or suspect that you may be pregnant. There is uncertainty about whether this drug passes into breast milk, and because of the potential risk to the infant, it's not recommended to breastfeed while using this drug and for at least 2 weeks after stopping treatment. Consulting with your doctor before breastfeeding is important. When taking anastrozole 1 mg tablet aromatase inhibitors, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with anastrozole are estrogens, tamoxifen, and tibolone. Always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much anastrozole and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. It's important not to share this medication with others. While taking anastrozole 1 mg tablet, it's important to have regular lab and medical tests, such as cholesterol levels, liver function, and bone density. Make sure to keep all medical and lab appointments, and consult your doctor for more details. This medication can increase the risk of bone loss, osteoporosis. It's important to talk with your doctor about your risk and available treatments for osteoporosis. Lifestyle changes that can help reduce the risk of bone loss include doing weight-bearing exercise, getting enough calcium and vitamin D, quitting smoking, and limiting alcohol intake. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store anastrozole 1 mg tablet aromatase inhibitors at room temperature, away from light and moisture. Make sure to keep it out of the bathroom, and always keep medications out of reach of children and pets. When it comes to getting rid of any unused or expired medication, it's crucial to avoid flushing it down the toilet or pouring it into a drain, unless specifically instructed to do so. Instead, consult with your pharmacist or local waste disposal company on the proper way to discard this product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.